Joining us now is Dr. Michael Hayes. He is the founding director of the Care Center at Penn State Cancer Institute. Dr. Hayes, thank you for joining us today.
Good morning.
First of all, explain what the acronym CARE means and just the importance of care overall with the Care Center.
Certainly. So the acronym stands for Cancer Assistance and Resource Education. That's what it means formally, but really what it means is exactly what it says. Fundamentally, the Care Center is about delivering care. It's one of the things that most of us know when we experience it, and it's so vitally important in the midst of cancer diagnosis and treatment that we look beyond the surgery, the chemotherapy, the radiation treatments. That's half of what's necessary. The other half is to make sure that we see the person and we're taking care of that individual.
Why is that so important to look at your cancer journey more holistically, and how can the Care Center really help people navigate that?
Certainly. What we know is that there are a host of personal situations that can and do sometimes complicate the course of treatment. It's really important, beyond getting the correct medical diagnosis and the proper treatment, to know and understand what are the other things alive in people's lives that can and do make receiving treatment more difficult. Sometimes barriers that prevent people from proceeding with the care that's being recommended.
Sure, like lack of support or financial challenges, and all the things that you had prior to your cancer diagnosis probably get exacerbated at that point.
Absolutely.
Yeah. So the center's been open since 2021. Talk a little bit about the services that you provide and how you've seen it really make a difference for patients.
Well, there are a whole range of services that are offered, from individual assessments where we're really getting to know and understand you, your situation, and what your unique needs may be. Beyond that, we offer individual, couple, family, and group psychotherapy, support groups for caregivers for people experiencing grief and loss, as well as young adult cancer survivors, so individuals in their 20s and 30s. Susan, it's really important, though, too, we look beyond the cancer to support wellness. So we have a program called Survive Well, as an example. We have another program that's really about creative writing and tapping into people's inherent wisdom, using writing as a window to connect with what's meaningful for them.
It sounds like there's a whole host of services that you offer, and I'm sure people listening might be thinking, oh, it's just enough for me to go to my doctor's appointments and to just feel better. How can you kind of meet the people going through cancer where their needs are most? Because some of these programs might be kind of too much for them at certain points of their journey.
What you're pointing to, Susan, is exactly right. What we need to do is meet the person exactly where they are. And at the outset of treatment, it may or may not be the right time for an individual. Our hope is to set a foundation, to sow the seed of awareness that we're here for you whenever that need may surface, whether it's early in the treatment process or much later, even years beyond active treatment.
And it is so much about the whole family, too. I shared with you before when my father was going through multiple myeloma, even back 26 years now. He identified the need to be Bill, not a cancer patient, not a multiple myeloma patient. He wanted to talk about his family and about golf, and I'm sure those are things that you now do in the Cancer Care Center to try to help people focus on themselves as a person.
It's absolutely true. I appreciate your father's wisdom. Shortly after the Care Center opened, a few months into our work there, I was meeting with a woman diagnosed with breast cancer. It was our second visit. She was sitting across the office on the sofa. She paused and looked at me and said, "You know, this place is for me." And when I heard her say that, my heart just burst with joy that she nailed it. Fundamentally, that's exactly true. She was helping to find her way back to herself, which is so important.
Thank you for sharing this all, Michael. Explain just quickly, how can people get in touch if they want to learn more?
Sure, there are a few ways. To ask the provider, the caregiver in the Cancer Institute to make a referral. People can always call the Care Center through our contact line or visit the website to find out more information. Lastly, I would say they can walk in. Physically, we sit right above Starbucks in the Cancer Institute on the second floor, so everyone is welcome.